Keep your head up. You're not alone. Keep your head up. Keep your head up. We're halfway home.
It's time for Your Voices of Hope, a video podcast program that offers straight talk on some of the major issues facing us today: addiction, domestic violence, homelessness, human trafficking, and suicide. But more than that, it's our desire to inspire hope. Now, your host, Michelle Beyer.
Welcome to Your Voices of Hope. I am your host, Michelle Beyer. You can listen to the past shows on my website, yourvoicesofhope.com. And please like me on your Facebook, on my Facebook, Your Voices of Hope. Today, I want to talk about CommQuest's recent opening of their new detox center in Altman Hospital. This detox center, wow, I'm getting so tongue-tied today. Their detox center is something that we so need in our community because of this, between meth and heroin, we just have so much going on here. And today, my guest that is going to tell us all about this program is their nursing supervisor and my friend, James Fye. How are you, James?
Very well. Thank you very much for having me.
Well, as always, I love having you, and I get to see you, and this is awesome. So I know there's a detox center that CommQuest has in Massillon called ReCore. And they had opened up a detox center in Alliance.
Yes.
And so now they opened one in Altman Hospital.
So we are actually the ReCore Detox facility that moved into Altman Hospital.
Oh, so what did they do with the ReCore, that area there?
So that facility has actually become one of our girls' houses for residential.
Oh.
So we had the ReCore facility, which was a 12-bed facility that they started back in 2015. And over the years, it became first opened up, and they did residential detox, 3 to 5, 7 days. And then it grew into a full medical detox in 2018 when the crisis center closed down. And then we had this opportunity to partner with Altman Hospital, and we moved into there. We're on the 6th floor. It's actually the old psychiatric unit. When I was in nursing school, I actually did my clinicals there when it was still open. So we were able to move there. We are more centrally located. We are a 20-bed facility, so we added more beds. It just all around was a partnership that was nothing but check boxes and wins. Provided a better service for the community. We have, if somebody needs medical assistance, if they have medical issues, we have the hospital facility right there. If somebody were to overdose and let's say they get picked up and brought into the ER, now we have the opportunity that they can actually call up to the unit. They can talk to me, and I can go down and talk to that person. They will get discharged from the emergency room and come straight up to detox.
Nice.
We have, and we also have the availability. We go out to the floor and can provide consults and talk to the people and provide that opportunity. For example, there was a woman, she was an opiate user. She came into labor and delivery, had her baby 2 days ago. And I actually went over and spoke to her yesterday. We put a discharge plan together for her. She was not necessarily in need of detox services, but I was able to facilitate. And tomorrow she'll be treated outpatient at ReCore. So we just have that availability and that attachment to help them so much better and so much more.
So what is the trend? I know we're moving from heroin to meth. Are you seeing that? Or is there just as much heroin detoxing going on as there was before, and not so much meth? And do you detox from meth the way you did heroin? Let's clear all that up.
Yeah. All right. So when we think about opiates or a heroin user, there is actually a physical get sick, nasty withdrawal when they go without the drug. There's actually has to be a medically monitored, medicated, and treated detox. Meth, basically, it is once it's out of your system, meth, cocaine, when it's out of your system, anywhere from 48 to 72 hours, there's really no physical addiction, physical cravings that's left. Now, mental cravings can be just as powerful, if not more powerful, are still there. We do see and we do treat meth, we do treat cocaine, and each one is an individual case-by-case basis. Some people will need an inpatient treatment. Some people will just need, a referral and get them set up with outpatient treatment. But the opiate users, the alcohol users, those are primarily what the detox units were built for and are for. What am I seeing on my unit? It is, I would say it goes in spurts. It's not the overwhelming everybody's meth, everybody's opiate. We see a lot of division. I've got probably, I think I left today, there was 8 or 9 people on the unit, and it's probably 3 or 4 alcoholics, 2 or 3 opiate users, so we see an array of use.
So you're not jam-packed. That's good.
Yes, we have beds available, and so we have 20 beds at our facility. At Alliance Community Hospital, we have a sister facility that has 16 beds available that does the same services that we do. So there's, on any given day, over 30 detox beds, over 35 detox beds available. And very rarely between the two facilities will you find both of us full.
And that's a blessing, because I've had so many clients that I couldn't get into detox because it was full.
Yeah.
And when a person's ready to get sober, they're ready that minute. They may not be ready the next minute.
Right. And that's always been the goals. And it's one of the reasons why I've enjoyed my time in my career with CommQuest, is that's, Keith's philosophy is when somebody puts their hand out, he wants us to have those services that they need available to them. And I don't think people realize, Stark County is an abundance of recovery that you don't find. We look around and people just think, well, this is the normal. I get people from all over the state that come here. I've had people from Cincinnati drive to come into our unit because it was the closest available bed they could find.
When you say Keith, you're talking about?
Keith Holhuddle, our CEO.
Okay. A lot of people don't know who Keith is. Mm-hmm. Keith is one of the most amazing people you will ever want to meet.
He is.
He is. He really, really is. And I interviewed Keith. He was actually my first guest on my radio show 6 years ago. Mm-hmm. Right? 6 years ago. Yeah. And because he's in recovery.
Yeah.
He was an opiate user. Mm-hmm. So, and pharmacist. Yeah. Easy access.
Yeah, that's true.
So when they come into, they have to call first, or do they have to go into the ER? What is the procedure?
So traditionally what we like is you can call either of the units, see if there's a bed available. We'll offer you, ask you a few questions on the phone just to make sure that what you're looking for is what we provide. As far as coming in, you do not have to be seen in the ER. We tell everybody to arrive at the ER just because it's an area that everybody knows, and no matter what's going on, it's always open. So they'll arrive to the ER, they'll tell them that they're there for detox, they'll ask for their name and their birth date, call up to the unit and speak with one of our nurses, myself or one of the nurses there, and we will come down and talk to you and do what's called a pre-screening. Talking about what your use is, what's going on, how long it's been, any other medical factors or any reason that anything that we need to know. Basically, a medical history. When you come into the unit, you need to bring any prescription medications. If you have any other medical problems, you would need to bring your medications with you. Need to have a photo ID, and then we'll bring you up to the unit. We have an intake process where you'll meet with a counselor. They do a comprehensive an assessment. You'll meet with a nurse, and then we work together. That counselor and the nursing works together. We'll talk to the physician, our medical director, and set up an admission plan for you.
How long do they typically stay in the detox
Our typical
unit?
stay is anywhere from 7 to 14 days.
And do you just kick them out after that, or do they have
Well,
options?
No, and that's one of the beauties of CommQuest is that we have so many follow-up options. If the next step we're going to be residential treatment, we have our men's facility, which is Wilson Hall. We have our female residential facilities in Deliverance House 1 and 2. So if residential is what that person would want, say we've got a male that's there, he's going through opiate detox, and he wants to go into Wilson Hall. So we're going to work with Wilson Hall. We're going to say, okay, his detox should be done Wednesday or Thursday. They'll have a bed available. They'll say, well, I'll have a bed available on Friday. So that patient would then stay till Friday. And on Friday, Wilson Hall will actually come and pick you up at the hospital and take you to residential. Our goal is always, once you come into our services, if you want to continue, you're going to move from one step to the next with us. I don't want to send you home and say, okay, on Friday, don't do anything, but show up on Friday.
Yeah, because that'll happen.
Right. It's not a realistic expectation.
Right.
You have an active, addictive user, and all they have is 7 days clean, but no recovery. So I'm not going to send you back to your house. I'm not going to put you back on the street. Our goal is always going to be that continuity of care, moving from one step to another. And even if they wanted to do outpatient treatment, say residential wouldn't work for them, it's not going to work with their family. So if I'm discharging you on Thursday, well, Friday, we're going to have your follow-up set at whatever office. All of that is worked with our counselors. We have an excellent counseling staff that meets with them throughout the day. They start, working. As we know as addicts ourselves, the problem isn't always lying in your addiction. Your problem lies in your head and in your heart. And that takes counseling, and that takes recovery and treatment. So that's an integral part of our process beginning in detox.
So you said outpatient at one of the facilities. How many facilities do you have for outpatients, and where are they located?
Okay, so you're going to give me this test. Well, Keith is watching this. Let's see. All right, so we have outpatient treatment facilities at ReCore, which is in Massillon. I have a Massillon outpatient office. We have Market Avenue, Cleveland Avenue. Alliance has an outpatient clinic. I have medication-assisted programs, dosing facilities. We do Subutex Suboxone treatment at ReCore in Massillon and in Market Avenue. Market Avenue also offers methadone. And Alliance offers outpatient Suboxone treatment. And let's see, Carrollton, Minerva, and I think that's it. If I missed any, check the website.
That probably would have been a real simple answer.
I could have done that too. CommQuest.org. All your answers.
I'm glad you didn't though. But tell us about the medication, the MAT program. There's a lot of people that will say, oh, well, Suboxone, you're still drugged up. What are your thoughts on that? What have you seen success-wise, or have you not even noted, experience? Maybe you haven't had any experience in watching it. Do you have any?
I can tell you that every person's journey is their own journey. Before I went onto the detox unit, I started at ReCore as an outpatient nurse. working in our MAT program and seeing and treating and starting people on Suboxone, Subutex. And I can tell you this, I see more people that get sober with that assistance than without it. Opiate addiction, I personally have never had an issue with it. I had never worked hand in hand with it until I started in this field. And I can tell you this, it's no joke. And you can't tell an addict that is literally aching from every ounce of their body, and their body is screaming for more and screaming for more, and say, well, you've just got to hold on and not do it. If I can give you a medication that on day 2 is going to take away that craving, and then you can start working with that person. You can start working and getting recovery and getting that person and working with their head, with their heart, working with counselors. What's the problem? What's the core of this? And none of our plan is never to start somebody on a medication and keep them on it forever. The day that we start a medication, we start a discharge plan. And I can tell you, I've been there when people started on day 1, and I've been there when they stopped on day whatever. And there's a tapering program, and we take them off. But you're doing that with somebody who's got 6 months, a year. It's a program and a plan that is worked with the person, with their counselor, with their physician, with their sponsor, with their program. All of these things are coming together at the end, down the road, and let's go and do that next step.
Right. Now, I remember 6 years ago when I was speaking to Keith about this, I was one of those people that were totally against Suboxone. And he said, you need to speak to, I believe it was his nurse supervisor at the Market Avenue facility, because he said you wouldn't think that way if you knew more about it.
Right.
And he's right. He was right, because I don't now. I see what it does. And Vivitrol, now that's not the same thing. That's totally different. And that is the be all end all for me. I love that. That medication is amazing. And do you use that to help in your facility? Let's tell everybody what that is first.
So Vivitrol is a medication very, very similar to its naltrexone, which is in essence what we think of a Narcan. All right. So it basically blocks the opiate receptor. And if you were to use, it would be ill-effective. And it also works and takes away the craving. The beauty of this is it's an every 28-day injection. So one shot, one time, come back in a month. Works very well. We've had very positive results for opiate addicts, alcoholics. I can tell you, I personally have given it. I think it is an amazing medication. I started a girl on it yesterday, gave her first injection. It's wonderful. And the beauty of it is, with your buprenorphine or your subs, if you did, it's still an opiate replacement. So if you stop, you're still going to have withdrawal symptoms. The beauty of Vivitrol is if you decide 2 weeks into this, well, this isn't for me, then you just don't get your next shot. And there's no withdrawal. There's no side effects. Overall, there's really no, if you take it, you take it. If you don't, you don't. It does help. I have many, many patients that will rave about it. Success stories, it's amazing. And it's a simple, it's an easy, it's an injection, and that's it, every 28 days.
Yeah, I'd like to talk to someone that has been on it for quite some time, and that is my next goal, because I have not, when I was doing these interviews early on, that was such a new drug that it was not very popular yet.
Right.
Nobody was taking it. So I really need to get a hold of someone that is taking that, because I can't wait to hear all those success stories with that. Now, can someone that does meth take it? Is it effective for meth users?
So according to the manufacturer and the studies and whatnot that they've done, no, it is not a treatment for meth. I can tell you that I've seen positive results. The meth is predominantly a mental craving, a mental fixation. One of the effects of the Vivitrol is that it breaks down what, in essence, easy terms, your cravings receptor. So I've had people that had alcohol use and they've gotten the Vivitrol and possibly had used meth on the side, but tell me that above all, they just feel better. The cravings is gone. Okay. So I think, and from my understanding, that the manufacturer is doing some studies and is looking at it being a treatment option for that. I think it would be successful as one.
Yeah, I agree. Is there anything out there right now for meth users?
Not presently at the moment, no. Because there's not a medication. It's
in their head.
Behavior change, right? Behavior modification.
And I don't mean in your head like it's all in your head,
Right.
It's, yeah. And that's rough.
Mm-hmm.
That's a rough hurdle.
It is.
I have a client now that has been through, in and out of treatment, and I just keep having to, I'll keep taking her back and keep taking her back. And now with the stimulus money, there's so many people going back.
Right. Yeah. Oh yeah.
Money's a trigger.
It is. Money's a trigger, and it becomes your solution. It's the same with any other, but what do you do when you're happy? You get high. What do you do when you're sad? What do you do when you're bored?
Oh, yeah.
What do you do? It's,
Yeah.
The addict doesn't change. It's just the drug.
You reminded me when I was drinking, I got a new job. I went out to the bar to celebrate. Mm-hmm. When I didn't get the job, I went to the bar because I was depressed.
Right.
So you don't need an excuse. You just have an excuse.
Mm-hmm. Exactly. And that's part of the recovery and the process. That's, that's part of program meetings, counseling. It's we as addicts learn, how do I deal with something? Well, my go-to is this. For me, it was drinking. For some people, it's opiates. For some people, it's meth. For, whatever the addiction is.
So when they're in there, they're in the detox unit. Mm-hmm. Are you offering other programs? Are you offering groups? Are you offering anything to them? I mean, or are they just sitting in a room in a bed and just sick? Or
no, we have. So normally we're in a little bit of a COVID change right now with the social distancing and stuff. But normally, an average day for somebody in the detox unit would be a breakfast in the morning. They would meet with their counselor. We have a full group with everybody in the morning, individual counseling sessions, lunch, and then again in the afternoon, we'll do a second group. And then we usually in the evenings, somebody AA, NA, HA have all come into the unit and do meetings. So right now with all of the changes and distancing and everything, things are a little different, but we try and fill up their day. It's a busy day. Every person that's on the floor sees their counselor every day. They're in group. And if there's, the counselors are usually getting pulled in, somebody's upset about this and wants to talk about this. And, we'll also do some smaller groups if we have the need and the want to. So, it's a busy day. They have a group room. We've got a TV in there. There's board games, puzzles, books. Right now, everybody, they have their own bed, their own space, bathroom. So,
Nice.
It's a great setup. I mean, like I said, it was a previous hospital unit. So imagine your hospital room. Each room has it. We've put a desk and a chair. They're given a notebook, writing utensils. A lot of journaling is come and had a lot of success.
Yes.
So, I mean, and there's that person that you don't want to mess with them for the first day or two. They need to get better. They need to feel better. So,
right. Well, is there anything else that you'd like to tell us about CommQuest in general, or the detox center that we need to know? Any secrets about what CommQuest is up to? Because you know what? I know Keith, and he just doesn't lie down quietly.
Well, I honestly don't think we were the last big secret, this unit. We moved over the end of February, and then the world kind of changed in March. So right now, what I'd like everybody to know is that we're open. We've been open. We never stopped taking patients. Alliance is still taking patients. I don't think we've had one day that the unit was empty. The need is still there. We're still there. Our residential facilities are still open. Our outpatient facilities are still open. There's some counseling is a little bit different sometimes with the telehealth, but the options, we've made some changes. We have adjusted, but our services every day are still available for anybody that needs them.
Awesome. And I love, personally, telehealth. I love it. Mm-hmm. I just did that with a doctor the other day, 2 different doctors. I love it. I don't have to leave my house.
I know.
It's great. So, the times are changing. We have to kind of go with the change.
Yeah.
And that's just like your recovery. You have to go with the change. You can't be stuck.
No.
So if you're stuck, you're dying.
Yeah.
So, well, James, thank you so much for coming on my show today and sharing with us this wonderful facility. And with CommQuest, there's no such thing as a not wonderful facility.
Right.
When Keith does something, Keith does it right.
That is true.
And your comfort is always taken into account with him.
Yes.
And there's never a detail that is left undone.
No.
And that is one of the things I love about CommQuest, which is where I did my rehab.
Mm-hmm.
I adore CommQuest, and I'm sure I'm biased, but that's okay.
That's all right. We'll let it go. That's fine.
We'll just let it go. So I want to thank you for sharing that with us. And please, anytime that anything's going on, you just call me up, let me know. You can come on and share that with us anytime.
Thank you, Michelle. Thank you very much for your support, and thank you for all that you do for us.
Well, thank you. And thank you all for listening to another episode of Your Voices of Hope. And thanks again. James is the nursing supervisor for CommQuest, the recent opening of their detox center in Altman Hospital. And if you would like to be a guest on my show, please go to yourvoicesofhope.com and scroll down to the bottom of the page. There is a form to fill out, or you could go over to my Facebook page and go over to the message center and fill out there, and I will get back to you as soon as I can. And as always, please love yourself. Thank you. Have a great day. Thanks a lot, James.
Thank you.
You've been listening to Your Voices of Hope with your host, Michelle Beyer. This podcast and earlier programs are available for viewing on our Facebook page, Your Voices of Hope, or our website, yourvoicesofhope.com. A new podcast is uploaded and ready to view every Wednesday at 7 o'clock p.m.
Keep your head up, keep your head up. You're not alone. Keep your head up, keep your head up. You're not